The first question, and one that we have gotten a lot in a lot of different forms, is, can I ever go medication free? And I think related to that, when is the right time to start talking to my doctor about tapering off? So I'll ask Nigila your thoughts on that first.
Okay, I think Victoria brought that up a little earlier on, and I had touched on it also earlier on. If somebody asked me directly, like, can I ever go medication free, I would be careful in answering that question. There have been trials, there have been people who have gone off medications completely and have stayed without medications probably for months or sometimes even years. But if you ask me as a clinician, can I go off medications? I would be really like, I will want to know what, I will have a set of questions to ask you. Why do you want to go off medications? So what is the difficulty you are having with your current medications? What are some of the things I can address at this point of time before we decide on whether we completely take you off medications, and whether this is beneficial for you or this is not benefiting you in the first place. If it is not benefiting you, then we have other alternatives for you. Are we going to continue the other alternatives for you? And whether we are going to like go off medications completely, and whether we are only going to rely on non-pharmacological methods of managing you, like pharmacotherapy or psychotherapy or other forms of therapy. I would say in I mentioned earlier, it is in bipolar disorder and certain conditions, medications are the mainstay in treatment. Pharmacotherapy is the mainstay. Psychotherapy, social therapy, other forms of supportive therapy are kind of complementary. They come as supplements. They work together. They work very well in combination. There have been trials I've allowed people to go. Like personally, what I've tried with some of my individual patients is that when they have like made up a mind, they have like decided, okay, I'm going to be off medications. I've respected the decision. The only thing I would tell them is like, okay, it's kind of like a condition I lay down for them and say that, okay, you go off medications, you have somebody to monitor and see what happens to you during this period of time. You see how your functioning goes during this period of time. And you please come back to me maybe like 6 months later and tell me what is happening. Whether things have been going as expected for you, whether there's been any big change in your life, whether there have been any form of distress happening in your life, whether there has been any big difficulty that has happened in your life, or you have been able to carry on life without any problems. And it's not just the individual telling me, it's not that I don't trust the individual, but it's also like I said, there is always a point of view, there's always a perspective when somebody else sees the person. And if this is a person who knows this individual well, it really means a lot. So the other person also gives me that corroborative information to say that, yeah, things have been going well. So I think the maximum I have tried without medications probably is about a year, but longer than that, no, because at some point of time, I think there is like some form of difficulty or change that happens. Either the sleep gets affected or the mood gets affected to a certain extent, and the person comes back and says, no, I think I should go back on medication. Yeah. So I know what maybe short periods of time. Yes, Victoria.
Yeah, no, and I was just going to say, and one of the questions was about sort of when to look at that. And for me, when I started looking at least tapering off or reducing anyway the amount, was when I really had a good sense of the self-management tools that worked for me, when I had a solid relationship and had done sort of psychotherapy. So I had all those things in place, and where there was a lot of stability in my life. And so, and my mood had been stable for quite a while, so that I knew that some of the things I was doing was really, it wasn't just the medication. And then, like you were saying, Nigila, monitoring the effects. So going into it like a research project. So sort of saying, okay, so we're going to reduce it this much, and in 2 weeks or in a month, let's see what's happening, and then continue to do that, and just be really as sort of objective as I can be, without sort of my emotional baggage of, what I really want, which is to be medication free, or at the time it was.